Good afternoon. We are about to start the Health, Hospitals, and Social Services Committee. Today is Tuesday, August the 18th, and I'm so happy to have you all join us. I'd first like to call the roll. Councilmember Benedict,
Present.
Councilmember Glover,
Present.
Councilmember Hall, Councilmember Hall, Councilmember Porterfield, Councilmember Porterfield, Councilmember Pulley,
Here.
Councilmember Welch, I think that Councilmember Porterfield and Councilmember Welch are in another meeting, but we do still have a quorum. Thank you all so much for being here. We've got a few items, and I will start with the motion from the governor that says pursuant to Governor Lee's executive order number 16 regarding electronic meetings, as extended by executive orders number 34 and 51, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. Is there a second?
Second.
All in favor?
Aye.
All in favor?
Aye.
Thank you. We have our first resolution is Resolution RS 2020-485, Welsh and Swara, referred to the Health, Hospitals, and Social Services Committee. Approves a contract for tobacco prevention program services between the Metro Board of Health and the Tennessee Department of Health to provide counseling and non-cash voucher incentives to pregnant and postpartum women and eligible household members.
So move.
Is there a second?
Second.
Thank you. Councilmember Welsh is not here, but I do think this is a self-explanatory resolution. Mr. Sharp, would you like to add anything to this resolution? Mr. Sharp? I thought I saw him on. Are there any questions in regards
Madam
to
Chair.
the resolution? Yes.
Do we have a letter or is there another sponsor?
We do not have a letter, and Councilmember Suarez is not listed here, and I'm not sure. I don't know if I signed on this. I may very well have. I just don't recall having done so.
If we don't, then we have to defer by rule.
Okay, but
If
let's
there's not a
just,
letter.
I know that Councilmember Welsh is on, so she may be in another meeting. So let's just go to the next one and come
Move to
back.
the Hill.
Okay.
All right.
Thank you. Thank you so much. The next resolution is RS 2020-486. Mendez, Welsh, and others accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide oral disease prevention services for school children in grades K through 8 in qualifying public schools. Is there a motion?
So moved.
Thank you. It's been properly moved and seconded. We do have a letter from Councilmember Mendez in approval. Is there any questions, comments in regards to this legislation? There being none, all in favor say aye.
Aye. Aye.
Any opposed? There being none, the resolution moves unanimously. Resolution RS 2020-496, Councilman Hall requests the Director of Finance to take the appropriate action to recoup all funds appropriated in fiscal year 2021 Metro government operating budget to the Metro Hospital Authority that were also covered by Federal CARES Act and other COVID-19 related funding sources. I do not have a letter, but does someone want to make a motion?
I moved that we defer by rule because this was deferred one meeting in Budget and Finance yesterday.
All right, thank you very much. Is there a second?
Second.
Thank you. All in favor?
Aye.
Aye.
Any opposed? There being none, the motion to defer by rule is approved unanimously. We do have a couple of late items, and one is filed by Hurt and Welsh. Approves a clinical research contract between the Metro Board of Health and Clinical Research Associates for Phase 3 COVID-19 vaccine testing. So I need to move as for suspension of the rules.
Second. I mean, well, that's fine. Yeah.
Second.
Okay. Any opposition to the suspension of the rules? Okay. Well, let me just.
Madam Chair.
Yes.
I'm sorry. Point of clarification. I think in committee you don't have to move. I think you're going to have to move on the floor for a.
Oh, okay.
Suspension.
Yeah. Okay. Great. Oh, thank you very much.
Yeah.
Thank you. I appreciate that, Councilman Glover. But I did want to give a little information in regards to this. Dr. Caldwell, as our medical director, has 30 years.
Yes.
Yes. Dr.
Yes, I'm here. Did you ask me a question, council member?
No, I just hear some feedback. I wasn't sure if someone was trying to.
I apologize. I'll mute myself.
Okay, thank you. But Dr. Caldwell is with us, and he has over 30 years working with clinical research and has clinical research associates that's also been a part of doing this type of work for some 20 plus years. They are being used by Meharry right now for their IRBs. They've dealt with several drug companies, and they're seeking a manufacture of a vaccine that's going to be safe and effective. They want us to recruit a few thousand people to utilize this vaccine. We have Katie Stone, who's helping with recruiting legally. We also have this as an exclusive contract with CRA that's going to kind of serve more as an agreement, more so a contract agreement. Dr. Stephanie Bailey is working with this and providing the services, along with Dr. Joanna Shaw Kai, who is a TB infectious disease physician at Meharry Medical College. So they come with quite a bit of experience in doing this type of work. I will yield to the floor to Dr. Caldwell to add any other things that he'd like to give any more summation of this particular contract.
Thank you, Madam Chair. Just doing a sound check. Can you hear me okay?
Yes, we can.
Okay, thank you so much. And thank you all for looking at this opportunity that our Nashville Department of Health has to partner in a small way with clinical research associates to help with bringing COVID vaccine research trials to test the safety and efficacy of these vaccines and allow our community members to volunteer if that's right for them. The more that we can get clinical research trials here in Nashville, the more that our community can be educated about the process of safety and testing for medicines, including these vaccines. We really look forward to partnering with Clinical Research Associates as just one small partner to a larger process. And we're happy to answer any specific questions that you or the members may have.
Thank you, Dr. Caldwell. Are there any questions regarding this contract or any questions for Dr. Caldwell? If not, may I have a motion?
Move.
Is there a second?
Second.
Second.
Thank you. It's been probably moved and seconded. All in favor?
Aye.
Aye.
Any opposes? There being none, and the motion passes unanimously. The last resolution that we had to file was a resolution by Councilmember Sepulveda, Mendez, Johnston, and Gamble, which proposes recommendations by the COVID-19 Financial Oversight Committee for distribution of $2.5 million in CARES Act funds from the COVID-19 Pandemic Fund to provide food assistance for Davidson County residents affected by COVID-19 to be administered by Second Harvest Food Bank of Middle Tennessee using the One Fair Share Nashville preliminary report submitted by the Equity Alliance and commissioned by the mayor's office. Is there a motion?
Move.
Second.
So I don't have a letter. Is anyone on the call? Councilmember Johnston or Councilmember Gamble, are you on the call? I see Councilmember Porterfield's hand raised. Are you, have you signed on to this, or would you have a question?
I have not signed on, Chair. Am I able to sign on to keep it moving forward?
Now that,
This is Hannah. You can sign on. You just need to send an email to the clerk, but you could handle it in this committee.
Okay, I'll sign on then so that it can go forward.
thank you, Councilmember Porterfield. Although I think that the resolution basically speaks for itself, are there any questions or comments in regards to this resolution? There being none, all in favor say aye.
Aye.
Any opposes? No opposes. The resolution passes unanimously, and that ends our meeting. Thank you all very, very much.
Real quick, you still have RS 2024-85.
Oh, that's right. We need to go back to that one. I thank you very much. Has Councilmember Welch or Suara?
I'm here.
Join us?
Welch is here.
Great, wonderful. So, do you want to give us a little background about your resolution regarding the tobacco prevention?
This is just a resolution to direct resources towards working with postpartum women, give non-cash incentives to encourage women not to use tobacco products for their health and the health of their children.
Great. Any questions for Councilmember Welsh? There being none, all in favor say aye.
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 Councilmember Porterfield, your hand's still up. Do you have a question? Or is
I
that from the previous?
apologize. It was an error.
Okay, thank you. Any opposed? Then the resolution passes unanimously. Are there any other questions, comments, anything of discussion that needs to be, yes, Councilman Porterfield.
I did raise my hand this time. I had some tech issues when you guys did the roll call, so obviously I'm here because I've spoken, but I just wanted to make sure that I was noted as being present. Thank you.
Okay, thank you. Anything else? Well, thank you all so much for attending. We appreciate it, and we'll see you shortly. Thank you. The meeting is adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.